In today's economy, it is much smarter for companies to be able to move their compounds forward as fast as possible. And one of the ways to do that is to be able to get into the phase 1 studies as quickly as possible with as little amount of API as necessary. So let's talk about what are the ways that we can develop formulations that can go into a phase 1 study. There's really 4 main approaches that you can use. You can use API in a bottle, you can use a powder blend in a bottle, you can use API in a capsule, or you can use the traditional way of developing a tablet or capsule formulation. We don't need to talk much about the traditional way because I think everybody is very familiar with that. But let's focus in on doing API in a capsule. In the last few years, this has really come on as one of the ways of being able to move compounds forward in phase 1 as quickly as possible with as little or minimal amount of resources put behind it. One of the ways that you can do this is to be able to use a piece of equipment called an Xcel that allows you to be able to put very minute quantities of API in a capsule, going down to as low as 1 milligram and all the way up to as whatever the volume of the capsule that you're using will allow you to fill. Usually you can fill somewhere around the range of 200 to 250 milligrams in a capsule. But what are the advantages of being able to do this? The biggest advantage is that you don't need any excipients that are added to it, so there's no formulation development time, and you can minimize the amount of problems that you see with the stability. There's also a minimal amount of analytical support. You're basically using the API method that's been developed, and you don't have to develop a new method for the drug product itself. You're minimizing the amount of API requirements because it's very easy to establish the fill weights that you're using. It also allows you to vary the amount of strengths that you're going to provide for a phase 1 study as easily as possible. You can provide a 1 milligram, a 5 milligram, a 10 milligram, a 50 milligram, and a 100 milligram with minimal waste of the drug as in the process, because it's very easy to just dial in the new fill weights and to go ahead and provide that strength for you. You also do not need cleaning verification. Excuse me, you may not need cleaning verification if you're using an autodose, but let's focus again on the Xcel and the advantages of that. And it's also very easy to provide a matching placebo. You can provide it as simply as using a lactose or an Xcel, and if you want to, you can provide it at the exact weights that your strengths are filled at, or you can put something in between and kind of match the placebo with 2 or 3 of the strengths that are being used. And what are the potential disadvantages of this? You do still need to consider the dissolution of the product, and this may become a problem, particularly if you try to pack in too much into the capsule, where the drug may not dissolve very readily. You also need to consider the compatibility with the capsule shell, but we've worked with a large number of compounds and we have not seen the capsule shell to be a problem as far as stability concerns. You also need to take into consideration the API characteristics, making sure that it's going to fill. It is a hopper system that will fill into the capsule, and you need to be able to make sure that the flow of the material is going to be adequate. Sometimes we find that the drug will agglomerate a little bit, but we've been able to fill a number of different compounds somewhere in the range of 35 to 40, and we've been successful with each one. And those go as low as 1 microgram in a capsule all the way up to hundreds of milligrams in the capsule. So let's talk about the piece of equipment that we utilize for this, the Xcel. We have 2 units, the Xcel 600 and Xcel 600S. These 2 units can fill upwards in the range of 300 capsules an hour, depending on what the fill weight is and how well the material behaves that's utilizing it. They will provide a complete set of fill weights, so each capsule is individually weighed, and if needed, you can get a copy of that fill weight. But what this allows you to do then is to minimize the amount of API that's needed. It minimizes the amount of analytical support. We can do it much faster. We can cut down by as much as 3 to 4 months in the development time to get somebody to a phase 1 study to where they have clinical supplies released. And you can minimize all the costs associated with that. So the advantages is very clear. It's a smart way to be able to provide a faster dosage form for your phase 1 studies.